Welcome back to the show. Dana, as promised, we just
Yeah.
couldn't help ourselves. Now we have to do an episode on trauma-informed
Right.
care.
Exactly. Yeah.
We just
We
have to.
probably, I think that's it's certainly a buzzword in our field, trauma-informed care, right? I'm curious if our audience has heard of that. People have certainly probably heard of complex trauma, going to therapy to work on your trauma, those kinds of things, right? But trauma-informed care is really a very specific type of practice, and that is being trained in working with trauma, right? It isn't just, any therapist you can go to see any therapist and they're like, oh yeah, I'll help you deal with trauma. No, there's very specific tenets and training and mindsets and steps, if you will, that you go through to deal with someone who has significant trauma, especially if it's complex trauma, that it was something that you adhered to, if you will, when you were a kid. And Gwen and I both agree that I think if you grew up neurodivergent, whether you knew or not early, definitely you should be seeking trauma-informed care.
Yep.
That everybody, as a function of being so different and being bullied and not understanding yourself and having a hard time, et cetera, et cetera. I have yet to meet a neurodivergent person that doesn't have complex trauma.
Agreed.
Some have worked on it more than others, but it's always there, right? Just because of the pond you're growing up in. But trauma-informed, I first cut my teeth in learning how to do therapy before I even got all the way through my master or through my doctoral program. I didn't get a master's, actually I did, but that's another story. That I learned the how-tos and the hands-on and those kinds of things on how to work through trauma. The thing that always stuck in my mind was like, you shouldn't be giving a loaded gun to a 4-year-old. And that's what a lot of therapists think. Oh, well, we'll talk about their trauma and they'll be fine. No, there are, especially if you're talking about something that, if you imagine you have a diseased tree and you have one limb that has disease, and you can see it, everybody can see it, it's relatively recent. It's because something hit that limb and sap is coming out and there's like an injury to the tree, and you say, most of us intuitively would know, just cut that limb off and it'll be fine. That would be non-trauma informed care. That would be like, okay, you have this thing that just happened. Let's deal with it. What I always think of adjustment disorder stuff, like something's happened in your life, you're having a little trouble dealing with it, we'll help you deal with it. End of story. Trauma-informed would be like, as the tree was growing, have you seen these trees where they like splice together? Like we have some in our park that it's clear that they're ornamental cherries, but the base is something else, right? That's more robust and strong, because those tend to not do well on their own here. And so you'll see elsewhere, all through the branches, there's different bark. Some looks like the cherry tree, some looks like whatever it is they spliced it to. So it's sort of inherently inside and everywhere. You can't just start cutting off branches because you'll kill the tree, right? It's too much. So trauma-informed care really goes into, it's about relationship building, making sure the person trusts you, because that's a central tenet that gets damaged in folks that have complex trauma. You have to do what's called resource installation, which just makes sure people have things to rely on for once you start unpacking the trauma, that they can deal with it, they can cope. Yeah. Those two processes usually, in my experience, in my own journey and in working with other people, are usually at least a year of therapy, at least, right? I can remember I didn't really get into any deep stuff in therapy till beyond a year, right? And that was in an intensive workshop thing where I finally sort of popped. And you have to know how much you can uncover at the speed you can uncover it, right? The idea isn't just to uncover the trauma, talk about it, and then move on. If you do that, you're doing what's called recapitulating the trauma, right? You're just talking about it, you're redoing the trauma, nothing changes, and then the person just gets re-traumatized, which I have clients come that have had that done in spades to them from non-trauma informed therapy. People just think, if you just talk about what happened, you'll be fine. you have to integrate that, talk about it, certainly make sense of it. Maybe something happened to you when you were 8 and you couldn't make sense of it then. How can you make sense of it with your adult brain? How can you deal with the shame about what happened to you? How can you deal with, you feel like it was your fault because you didn't do anything? You were 8, right?
Mhm.
And you would think that those things could just be easily cognitively dealt with. Like, well, you were 8. Of course you couldn't help, what this adult was doing to you.
Mhm.
That process, there's so many things that have been put in place through those branches that are intertwined that are about internalized shame, internalized blame, the sense of I'm dirty and I'm ruined and will never be okay. Those things you have to unpack slowly too. And those are, you never know when each one of those are going to pop up with anything that you're unpacking. And then what I tend to see and what I did in my own therapy was, ooh, I got through a piece of this. This feels really good. Let's go, let's go, let's go. And then you get people wanting to do too much too soon, and then
Yeah.
they decompensate. And so the therapist's job also is to deal with pacing around that. And typically, if you're talking complex trauma, the entire course of therapy, minimum would be 3 or 4 years. I have folks that I've worked with for 7 or 8 years, and then we just start to talk about, you might be okay to fly on your own at this point.
Yeah.
My therapy was many, many years, but I had just a lot of stuff that I was dealing with. So to talk about tenets of trauma sort of cavalierly, going off our last episode, I've seen people in the Showed Up in a Meme, people talking about, trauma bonding. I trauma bonded with my friend because we both went through this traumatic experience together. No, trauma bonding by a trauma-informed therapist is, for example, if you have a parent who is your abuser, and by all means, as an adult, you should think that person was bad. I shouldn't like them. I shouldn't still love them, right? They hurt me. Trauma bonding is when you are a little kid like that and something happens to you when you're young and you don't have the resources to deal with it, then you have to depend on this person. You're going to stay attached. And there's almost a dependence to that abuse that happens. And then you see people get to the age where they move out on their own and they get attracted towards other abusive relationships. That becomes the normal. It's comfortable because you're used to it, right? And all kinds of things that can come out from there. That's true trauma bonding. It's almost like you're having a weird, unexpected bond to someone who abused you. It doesn't cognitively make sense, but it sort of does from a trauma-informed care lens, because those things are complex and take a while to unpack, right?
Yeah.
You're teaching, you're reparenting your client to not default to the shame thing or excusing my mom for continuing to hurt me, but rather let's frame what your mom said to you. And that was really, a shaming, abusive thing to say to you. You're 48 now, but your mom's still saying those things over and over and over and over until one day they finally come to you and they say, my mom said this thing, and right in real time, I was like, you're so full of it, right? And you're like, yeah. But those take a long time. If it takes you 30 plus years to lay down that trauma tree, imagine how long. You're not going to undo all that in a year, right? These are not an 8-session fix, right?
I mean, this is why our system
Mm-hmm.
in our conceptualization of mental health and therapy is so broken.
Yeah.
When insurance companies give you 12 sessions in a year,
Yeah, they
I'm not
can't
really
anymore. By the way,
right.
it's supposed. Yeah, that's a parity act that passed about 10 years ago. Prior to that,
Well,
sometimes that's all you
so
had, or
those of you
3,
like check on that, because let me just say that's still happening.
depending on the diagnosis. Yeah,
Yes.
yeah,
Yeah.
yeah,
So just, but the idea that, oh yeah, it's easy. I mean, I love that analogy. Just cut off the branch.
yeah, yeah.
When really we are a product of the culmination of all of our experiences over our
Mm-hmm,
lifetime.
mm-hmm. Yeah,
And so it's just not that easy. And that's why we do have to be nuanced, and
yeah.
Dana's observation of, someone taking, a year to just get resourced.
Mm-hmm.
Um,
Or trust the
that's our new
therapist.
shirt. Get resourced.
Get resource.
That's it.
Right.
But that could be longer for some people. That could be
Yeah,
shorter for some people too. The point of Dana's, I think, correct me if I'm wrong, Dana, a
yeah.
year is that is not easy, because you do need to retrain your automatic feelings
Mm-hmm.
and narratives and relationships. It's almost like changing, it's not changing. I often say this to my clients,
Mm-hmm.
it's not changing your thoughts per se, especially my autistic clients whose thoughts
Mm-hmm.
are free flowing. And my
Mm-hmm.
ADHDers that I work with, I mean, the thoughts are
Untethered. It's
like
impossible to tether.
flow, like wow, like you're
Uh,
getting swept away by just current, this very strong current.
yeah,
It's not even like changing those per se, but it's changing the relationship you have with those.
yeah, yeah.
And that takes a long time. And how could we blame anyone who has had complex trauma in their life, who
Mm-hmm.
has had failed therapeutic attempts
Yeah.
because of our colleagues, which Dana and I have spoken about,
Yep.
immensely, not
Yep.
saying that I don't make mistakes. I make plenty of mistakes as a therapist.
Yep.
Um, but you have to build a strong enough relationship with your client
Mm-hmm.
in order to do this and to know, to your point, Dana, how to load and pace. That's a therapist's
Yes.
job. A
Yep.
therapist's job is to load the challenge and the press in the session
Mm-hmm.
and how
Mm-hmm.
fast that happens. And
Yep.
sometimes when it's crawling, because I will say a lot of times I experience, where our pace is very slow because it has to
Yeah.
be,
It has to
because
be.
we get over a threshold. I overwhelm my client. They
Mm-hmm.
retreat. This is not
Yep.
even a conscious process. I'm not
Yeah.
saying it's a
Yeah.
conscious process,
It's and it's
but
adaptive, sort of. They need space to
totally.
deal with it. Yep. Yep.
So, we're meaning making all the way through. What does
Yeah.
that mean
Yeah.
to you? I ask this question. How do you understand that?
Mm-hmm.
If you
Mm-hmm.
don't know, I'm gonna throw spaghetti at a wall. Does anything resonate?
Yeah. Yeah.
And
Yeah.
that in and of itself can be exposure. And so a
Yeah.
lot of times in trauma work, when y- we're talking about difficult things or things that have happened in the past, we're
Mm-hmm.
exposing our clients to a potential trigger,
Yeah.
a
Yeah.
real one, by the way, not
Yeah.
not the triggers that we were talking about in our previous episode,
Right.
right?
Right. Right.
But a
Yeah.
real one. Now we're
Yeah.
re-traumatizing. You called it recapitulation.
Yeah. Yeah. Yeah.
Now we, as therapists,
Mm-hmm.
are re-triggering, re-traumatizing our client without resourcing
Mm-hmm. Or processing. I
or
can,
right.
I think I've shared on here before. I've done some pretty deep body work type therapy when I did mine back in the 80s and 90s. And I would have something come up. We'd do our thing, me and the therapist, and then afterwards, she'd always sort of bring me back into the here and now and have me talk about what I experienced.
Yeah.
And now I'm like, oh, that was the processing piece. And she never wanted to send me out the door when I was still in that activated state, to at least
Yeah.
get grounded and say, and then I took up journaling and I would write about it for an hour afterwards, right, to process
Yes.
it. So it isn't just enough to just experience it. You need to, we use fancy words like integrate and all that. What does that mean? We're actually trying to get you in those branches that are all intertwined to do your own form of reframing them, right? And then eventually you do enough of those individual limb repairs that then the themes of what you've done start to show up other places. Like I realize with a caretaker, if they say something to me, I automatically assume I'm not correct, right? Or I'm always wrong. It's like, ooh, that's a meta theme that
Yeah.
arose out of these other little things. And then
Yeah.
that's sort of exciting in therapy because you start to be able to apply your learning to multiple situations and not just that individual one that you had. And again, those process takes time, right? To
Yeah.
learn all of that. We don't have
Yeah.
you for 8 hours every day like school. We have an hour a week if we're lucky, right? It
If we're
takes some time.
lucky,
Yeah.
if we're even
Yeah.
lucky, right?
Yeah.
Well, and that the I think therapy is a very unique place.
Mm-hmm.
It feels familiar or friendly. It can because of the rapport
Mm-hmm.
you might build, but it's definitely not a
Mm-hmm.
friendship.
Yeah. Yeah.
Right? And it's a place where the psychologist or the therapist is supposed to be setting the professional frame
Yeah.
for that session to do something
Mm-hmm.
that you cannot do on your own.
Yeah, exactly. Yeah.
You
And doesn't
know?
that make sense? Wouldn't you need to trust that person to do
Oh
something
my
like
God.
that?
God.
Yeah. Yeah.
And if you went and you just spilled it all without, that in and of
Mhm.
itself is indicative of something.
Yeah.
Like, wait a minute, like, you don't know me. You don't know me yet,
Yeah, and
you
why is
know?
that? So in complex trauma, another
Yeah.
sort of main tenet of that is an attachment issue, usually,
Mhm.
right?
Mhm.
So you've learned to not trust, to not talk, to not feel those kinds of things, and so the attachment styles is something else I see used in pop psychology. Sometimes they get it right, sometimes they don't, but it's usually like you've been wounded, so you have a disruption to that attachment. But if this is someone who primarily is keeping you alive, i.e., like your parent, doesn't is that's kind of a bind, right? How do you deal with that, right? And so that's what we mean by attachment disruptions. So How can we walk through and talk through that relationship, and then also for you with me as your therapist, I don't want to keep doing that to you. I want you to experience someone who does hear you. And that's the artificiality of therapy that is so healing. You're not telling me your troubles and then me telling you mine, right? You get to unburden yourself and we hold it for you. And because of that, we can't be friends. We can't go to the movies together. We can't have a relationship. It needs to be that we've talked about that on here a lot too, that therapeutic container, so that you can dismantle yourself fully. And then we can make sure, scoop you up by the end of when you leave the session, that you can still drive home or get a
Right.
ride home, however that works, right?
Yeah.
And that, yeah, that if it's an attachment thing and you don't trust anybody for understandably because of what's happened to you. I have so many neurodivergent clients that come to me. One of the things I ask when I'm doing assessments is, what's the history of therapy that you've had?
Yeah.
It's never good. It's never
It's not.
good.
I know.
It's always they put me on this medication or they diagnose me as this, that, and the other thing, but I don't think that's true. I've done research. Or they told me I'm not autistic, it's just complex trauma, or they've told me it's not complex trauma, it's because you're just, I mean, it's just the list goes on and on and on and on and on, right? There's been a few occasionally that they have a pretty good therapist who's trauma informed,
Mhm.
and they come to me for an assessment because the therapist recognized they don't have the expertise to do an assessment for autism, and then I've sent them back that way, like, yes, this person is autistic. And now that therapist can do the trauma informed care and learn a little bit more about neurodivergence or bring it into the room. Like, yes, okay, I now have this person who is an expert in this saying, yes, this is true. Now let's work with that.
Yeah.
Versus, oh, you're not autistic, or yeah, you might be, but I don't know anything about that. So I'm not going to work on that at all. That's just ignoring a big gorilla in the room, too. Right.
Yeah.
So I see you're sort of nodding. You've seen all of those
Oh, all of it.
various ways
The
that people present.
I
Yeah.
think where I see the most amount of harm
Mm.
being done by therapists, not saying it's intentional,
Mhm.
um, is that they categorize or characterize, I should say, clients as lazy or unmotivated or not ready because they're either not doing homework,
Mhm.
they're not moving fast enough,
Mhm.
they're not saying the right things.
Mhm.
And it's like, I don't know what more I can do for you. Out.
Oh,
It's
yeah.
that kind of probably thing.
Imagine
Um,
if that a parent gave up on you and then you have a therapist do that to you.
yeah.
It's
Over
just
and over
over.
and over again too. Like
Oh,
it's not just one therapist, it might be two, three, four,
yeah.
five, like
Yeah.
I
Why would you keep going back? I wouldn't.
right. And I think the message there too is if they're the professionals
Mhm.
and I keep failing, quote unquote, failing at a therapy,
Yeah. Yeah. Yeah.
who's the broken one?
Yeah.
And it
Right.
just really
Yeah.
reinforces the shame and the
That's right.
self-deprecation and the feelings of failure
Yeah.
that I see to be so pervasive,
Yeah.
especially in the adults that I see and
Yeah.
support. Life is hard, especially right now. They're
Oh
really
God.
picking up. A lot of I feel like a lot of the adults that I work with are empaths,
Yeah.
and so the state of the world
Oh,
is
it's
so
activating. Yeah.
overwhelming.
Yep.
They're exhausted.
Yeah.
And
Understandably.
that they're usually, we've spoken about this on a previous episode about being very fair and principled people.
Yeah. Yeah.
And
Yep.
so
Yep.
they see these just atrocities that are
Yeah.
happening, and it's so distressing and disturbing, and it
Hmm.
just reinforces it just disempowers and reinforces their helplessness
Right.
um in the world. And so I'm seeing a lot of that right now. But I think the other piece too is there's this real fine art
Mm.
of being professional and then being relatable.
Hmm. Hmm.
And that's hard. I find I struggle with that as a therapist.
Yeah.
I tend to be, I could never do Freudian or psychodynamic work. I mean, I'm
No.
not a
Oh.
blank slate
Yeah.
nearly enough to do that
Yeah.
work.
I do.
Um,
I do psychodynamic, more newer school, more
yeah,
Adlerian, because
more at
people will
layer.
say to
Yeah,
me all the time, "You're so easy to talk to," and I'm like, "Good.
yeah,
I'm doing my job then." Yeah.
yeah, yeah. And so I tend to be, I mean, a lot of my personality comes out in my work.
Yeah. It
It's like
should.
not
Yeah. Yeah.
uncommon for people to know that, I like, there's some real things that I really love, like my own interests and things that really
Yeah.
come out, or some of my analogies, or, it's clear. They
Right.
typically know that I'm either married or have a kid. Like they kind of
Yeah.
know
Yeah.
some of those details, you know what I
Sure.
mean?
Yeah.
So, I hear that a lot though. It's like,
Mhm.
I need to even, it's going to take me time to build a relationship. Like the rapport building phase can be really long, even.
Yeah.
And you
Yeah.
really need to like follow a lead there, especially with trauma informed care.
Mhm.
Like
Mhm.
pacing is
Mhm.
everything, even if it
And it's
means
not
like,
just, yeah, and building that relationship isn't just idle time.
no,
It
no, you're
might be
still
talking
learning a
about
lot. Yeah.
and/or, right?
Yeah.
And really geeking out on it together. That's
Yeah.
like this version of, "Oh, they get me."
Yeah.
I told them this was important to me, and they actually did it on off
Yes.
time, and now we're geeking out
Yes.
on it together. It's great, right?
Oh, yeah.
That is
Yeah.
that you can trust me, I do see you, I want to align with you, et cetera. Yeah,
Yeah.
yeah.
I've been open, my eyes have been open to lots of fun things, because
Mhm.
I tell
Yeah,
my clients a lot of times, give me some homework.
yeah. Yeah, Killing
I'm
Eve,
giving
that
you something.
series that I love was a client recommendation, and I
Yeah.
never would have watched it otherwise. It's awesome.
Right. It's
Yeah,
like I'm giving you something to try. You give me something to try.
exactly. Yeah,
Let's
yeah,
come back and see where we
yeah,
are on that. So,
yeah, yeah.
I think like that's really important. But trauma,
Mhm,
I would agree with you, Dana. I believe that if you are a neurodivergent person and you are
mhm,
looking for a therapist,
mhm.
you are going to want to make sure they're trauma informed
Yeah,
people,
yeah,
because they will at least know how to pace and follow your
yeah.
lead and validate your experience.
And not everybody is. It seems, I think that the layperson thinks that's what a therapist does. They're all
No,
trauma. They're not.
they are
This is a
not.
very, and you don't just pick this up in a class.
No.
It's a long-term training process, deliberate training process that's multidimensional.
Yeah.
You're learning a bunch of different ways about your clients, and you pick up those tools slowly. There's a reason why not everybody is trauma informed, because it's hard
Yeah.
and it takes a long time to pick it up, right? So if I go
And
see someone who says they're an expert in trauma, and it's clear that, be like, no, you're not an expert in trauma. Just because you got a doctoral degree doesn't mean you're an expert in trauma. Yeah.
yeah, and I would also be very wary for those of you who are looking for a therapist. If
Hmm.
your therapist write up has the list of diagnoses, I'll get my air quotes right,
Oh,
diagnoses
yeah,
and
yeah,
conditions that they treat, and it's
yeah,
like 10, 15, 20 lines, I would
yeah,
tell you to run,
yeah,
run
yeah.
away.
I know every
Like,
time I get re-paneled for insurance,
ah,
it'll say, "Don't you have other
no,
specialties?" And
no,
every time I'm like, "Should
no,
I check more?" And I'm like, "No, I
no,
don't. I
mm-mm,
don't feel like I'm competent and up on the newest thing to treat full blown eating disorders
nope,
anymore. There was a point in
nope,
my career that I was, but not anymore.
nope.
And you need to know what those things you can't. You know something about, but you certainly can't just bring
I
someone in
mean,
and treat it
even
for that.
my clients who are neurodivergent who might come to me with some drug use, that could include
Yeah,
marijuana. I'm like, I'm out.
yeah,
I
yeah,
am
yeah.
out.
Or
Like
make sure they're working with someone else at the same
yeah,
time. Yeah, I've had
yeah,
people go to AA meetings and things like that while they're working
sure,
with me. But yeah,
sure.
or I
But
made it a condition of therapy. If you don't go to 12-step meeting, we can't work together. Yeah.
Yeah, I mean, I'm pretty clear. I mean, it's like
Mhm.
it's like I see, and you have to be over 16. I mean, like you have to.
Mhm. Yeah,
It's
yeah, yeah.
so I literally have like probably I would put two lines. Like
Yeah,
on my
like a
like it's
funnel.
very narrow, very very
Yeah,
narrow now, which
exactly.
is just fine because it helps me hone my skill. And then
Yeah,
I do have to talk to other people, so I'm not just wearing one set of glasses, right?
right, exactly.
Um, but yeah, so I would say those would be some takeaways for trauma informed
Mhm,
work
mhm,
if you guys are
mhm.
looking. And it was important for Dana and I just feel like everyone says they're trauma informed these days.
Yeah, and they're not.
I'm not
It's
sure they
pretty
are.
clear when you just start to have a conversation with them that they're not really, because it really is a way of conceptualizing, and then some of the techniques that you pick up, but it's more about how you conceptualize a case than anything. Yeah.
And maybe even like you could even ask this question, like, what is your definition of trauma?
Yeah, there you go.
Because if
Yeah.
it's very limited to big T trauma stuff, you're out.
Yeah,
Get out.
yeah, yeah. But or if you are someone who's had combat trauma and you're in the VA, it's full
Hmm.
of experts that deal with that sort of
Yeah.
trauma. Great,
Yeah.
go there. I don't
Yes.
treat that sort of trauma, so
Yes.
go for it.
Yeah. There's
Yeah,
even types of trauma. Anyway.
yeah, yeah, exactly.
Okay. Well, on
Yeah.
that note, on that note, everyone, okay, be good to you, be good to others, and we will catch you in the next episode. Bye.
Bye, everybody.